Good afternoon, everyone. Good afternoon. My name is James McKenna, Town Manager with Logan, Town of Winthrop, and we're even though it's a bit wet outside, we're happy to have you all here today. It's a great day. Great to see you, Speaker. We have a number of folks here that have come together, I think, in a real show of a continuum of dialogue and partnership over the years regarding issues that have been explored by the Massachusetts Department of Public Health and with participation from many of you in the room. You know, when the Hazards Committee, Airport Hazards Committee of Winthrop met with our council a few weeks ago, we marveled at the fact that we counted their age, and I think we counted over half a millennium of experience on that committee. It's truly remarkable, you know, the amount of dedication and number of years that those folks from the Airport Hazards Committee has put into, you know, being vigilant about, you know, the interests of this town of Winthrop, and it's a great expression of community's commitment and support. I want to first acknowledge the folks that serve on that committee who are here. Jerry Falvo, who's led the charge, Tony Majahat, who's here, and John Tigliano, you're here, and Speaker DeLeo, who serve on that committee as well.
I'm not part of that.
No, not the whole, no, yeah, millenniums. Right, the curve slopes down, right. But anyway, thank you all for being here today. And I just want to acknowledge, I know Secretary Davey sends his regards today. He was interested in coming along, but has been delayed. Commissioner Bartlett was going to attend as well, but I'm really happy to have Suzanne Condon here from the Massachusetts Department of Public Health, Director of Bureau of Environmental Health, who really has been the lead officer on the study that we're all familiar with regarding the air quality measurements that were taken over the past decade with regard to the airport. So it's great to have you here, Commissioner. We also have here the Speaker who's led the charge on the whole issue of monitoring our proximity to Logan Airport and the committees involved in that over the years. Your tenure on this, Mr. Speaker, has been remarkable. Your dedication to public health and the interests of the communities that surround Massport and are in the vicinity of these issues has been remarkable. And so I want to thank you for your tireless leadership on this issue. As well, Senator Petruccelli, who very much spoke out in full-throated ways to make sure that the public health of the area is very much in the forefront of thought and policy initiatives, whatever they may be, regarding the Logan Airport. So thank you, Senator, for your continued support. We have Peter Gill from the council, the president of the town council here, representing the council. And we have with us as well representatives of Massport here to discuss hopefully some interesting and good news for us. And we also have Manny Lopes from the East Boston Neighborhood Health Center, a real partner with Winthrop in looking after us and our health and our public health needs. And we're very encouraged and hopefully embarking on new ventures with East Boston Neighborhood Health Center as well. So with that, I'd like to turn it over to Manny, and if you would come up and make a few comments.
Thanks, and pleasure to be here today. Thank the Speaker and Senator Petruccelli and those of you who are in the audience. So for over 40 years, the East Boston Neighborhood Health Center has been a partner here in Winthrop, providing care to 25% of the residents of Winthrop. And today I'm happy to share some good news. I know we're going to share other good news in terms of our relationship with Massport, but I also want you to know that the East Boston Neighborhood Health Center has made a commitment to opening up a facility here in Winthrop with the help of Speaker and Senator Petruccelli We've been working together over the past few months to hopefully identify a location and identify services that are needed in this community so we can provide easily accessible care, convenient care, and high-quality care for the residents of Winthrop. So as many of you know, today we're here to talk about the health center and the relationship that we've had over the past few years with Massport. Particularly, that's been strengthening by the appointment of Tom Glynn, CEO of Massport. Tom's been a longtime friend and an ally of Community Health Center and community work. So again, I just want to congratulate Tom on the short time he's been at Massport. It's been great to work directly with Tom and the rest of the team at Massport. And today we're here to talk about a grant that the health center will be receiving. We'll share more details of that grant. Our chief nursing officer is currently testifying at the State House, Bernadette Thomas. She just texted me. She's in a cab on her way over here to talk, but she'll be here not to talk about Ebola, but to talk about the program in detail. So she should be here shortly. But this really gives us an opportunity to expand, this grant will give us an opportunity to expand our services here in Winthrop, particularly around pediatric and asthma care. The health center has been doing a lot in this area, and with this grant we're hoping to expand our services. As you can see here, we have displayed, I'm not going to go through it because I'm not the clinician here, but a home kit that we will be providing for the families who are impacted by asthma, and as well as coordinated care services. And again, I'll leave it up to Bernadette to better explain the program in detail, but we look forward to working with Massport and looking forward to working with the community of Winthrop. So at this time, I'd like to welcome, as your Master of Ceremonies, I guess, I've been appointed to welcome Tom Glynn, CEO of Massport.
So good afternoon, and thank you very, very much, Manny, for that very gracious introduction. You know, I think we all kind of take for granted the East Boston Neighborhood Health Center has been around for so long and it's been so successful. We don't realize what a great scope it has and what great quality medical care it provides, and how it's always there when there's a gap in service, you know, like we're going to talk about today. So they always step up. They can always be counted on, and I think we all benefit in the whole community. They, you know, if there's a problem, they want to be part of the solution, and that's kind of the guiding principle for today. Massport wants to be part of the solution, not just part of the problem, and hopefully, you know, in a small way, we're going to indicate that with making this donation gift to the East Boston Health Center. I should say, echoing what's been said before, you know, you're very, very lucky in Winthrop to have such great political leadership. Senator Petruccelli, I work with on many, many issues, both here and also in East Boston. And, you know, he's somebody who knows how to figure out, you know, a solution. And we've come up with, you know, some good things that benefit both the community and also, you know, protect the kind of economic activity that the airport is able to generate. But it's unusual to have, as your representative, the Speaker of the House. And that's a very, very special situation that everybody benefits from in Winthrop. And as you all know, before he was the Speaker, he was the Chairman of the House Ways and Means Committee. So, you know, I remember when I first came over, 2 years ago almost, for my first meeting, and a lot of you were asking me about this study and when it was going to be done. And fortunately, I had the opportunity to say, well, call Public Health and my friend Suzanne, and she can fill you in. So it's great now that the study has been done for 6 months. We've had a chance to digest it and, you know, take some action. But I have to say, you know, along the way, nothing is that easy in government. So 14 years is a long time, but we wanted to make sure that what came out at the other end was high quality. And, you know, the Speaker was the person, every time things started to look like maybe they were slowing down a little bit, he would make sure, along with Senator Petruccelli, that we were moving forward. So first we had to agree there was a problem, and we got some great advice from the Winthrop Hazards Committee. Then we had to agree on a study. Then we had to figure out how to fund this study. Then the Speaker said to us, you know, don't wait for the study to be done. If there are things you guys can do to reduce the impacts on the neighborhood, do them now. And so we're happy to be able to report that we've done a bunch of things that have actually reduced a lot of the emissions by a significant amount over the last 14 years while we've been working on the study. Now the study comes out, the speaker says, well, we don't want to just focus on the study, what are you guys going to do? And so, today we're going to announce that we're making a grant to the East Boston Health Center for Winthrop for $170,000 to do the kind of work which you're going to hear about from the clinicians with these kits and with care that needs to be provided to people who've been identified and that have problems. Separately, we're going to do something in East Boston, but all of the resources we're talking about today are for Winthrop, and it's part of this new satellite facility that Manny talked about, which I think is going to make a big difference. People need access to primary care. They need it to be convenient. And so we're announcing a grant, but we're also announcing kind of a breakthrough in the way in which people in Winthrop can have access to care. A lot of folks already take advantage of the health center, but this is going to make it a lot easier for them to have something that's really in the neighborhood. So, the study was extremely well done by the Department of Public Health. We're very fortunate in Massachusetts to have somebody of Suzanne's caliber who has overseen the study from start to finish. She too relied on the speaker and Senator Petruccelli when kind of the going got tough and the state budget got a little bit constrained during the recession, but this was always a high priority, and the speaker made sure that it moved forward despite whatever the economic challenges might be. So that's why we're able to be here today to say here's the study and here's what we're planning to do in terms of making some resources available for care and for kits that should make a difference for the folks who were identified in the study, in the neighborhoods that were identified in the study. And finally, I just want to say that I've had a number of meetings with the Winthrop Hazards Committee, and this is a great example of a community organization identifying an issue, bringing it to the attention of elected officials getting the executive branch to respond. And so everybody should be very happy and proud today of the great work and the great partnership. It had its ups and downs. I know we're not done. I know there's other things that we need to do. But this is a milestone today, and we would not be here if the Winthrop Hazards Committee hadn't started the ball rolling many years ago in making sure that this was a priority and bringing it to the attention of two great political leaders like the Speaker and Senator Petruccelli. So I just am happy to be here. In a minute we will have the formal presentation, but thank you for giving us the chance to be part of the solution as well as part of the problem. Thank you.
Thank you, Tom. Now I'd like to introduce the Speaker of the House, who really doesn't need any introductions, but I just want to reiterate the appreciation that I have and thank the Speaker for working with the Health Center, particularly over the last couple of months as we try to define what were the needs here. And just for those of you who don't already know, you have the biggest advocate, of course, in the Speaker. He truly understands the needs of this town and this community, and really set out to make sure that we were going to be building or opening up a world-class facility here. So I just want to thank him again for his support and his encouragement throughout this process. And right now I'd like to welcome Speaker Robert DeLeo.
Thank you very much, Manny. We have so many things that we can be proud of today. First of all, as a member of the Airport Hazards Committee for some years, I can tell you that it's been interesting in terms of many of the pieces of legislation that we have seen gone through the House emanated from the Winthrop Airport Hazards Committee. I think if you take a look at this particular piece that we've been talking about, in terms of checking on the healthcare needs of those folks who surround airports, came here from Winthrop. Also, the other piece of legislation relative to having a community of the CDC, having a community like an advisory board to the airport, similar to the MWRA, that emanated from the Airport Hazards Committee as well. So to Jerry and Tony and Bob and Dick and all the other members of the committee, a sincere thank you for your hard work. You truly have been huge leaders in this field. Thank you very much. I was thinking with Anthony and Anthony actually was serving in the House, I think, with me on this, and I can remember each budget each time that we had to file legislation. Every opportunity we had, we filed an amendment to get a study done, relative to the airport. That's how far back it goes, and now he's gone on to bigger and better things. He's a big shot senator now, and but finally we got it done. And then we got a little, fiscal situation here in the Commonwealth, which might have slowed it down a bit. And Anthony, through his wisdom, came up with the idea. Well, let's have Massport pay for it. That was his idea. And finally we came to fruition and we got this done. And then when you have someone like Susan Condon over at DPH, that makes life a whole lot better in terms of the thoroughness of the report. And I want to thank, I've worked with you not only on this issue, but a whole host of other issues, and I thank you for that. And Manny Lopes, it's great that we're going to have him in our community. We've been discussing this, bringing the health center into Winthrop also for a period of time. We were close once, but now, as I said to him yesterday, you're sure this is going to happen, right? And he said he is, so I'm taking your word for that. But that will be of service not only to the young folks or other folks who may be affected through the airport, but through all illnesses, increasing the number of primary care doctors that we will now have in our community, which I think everyone in this room knows is so necessary. To Tom Glynn, I will say, Tom, you have been a pleasure to work with. Whenever we talk about Winthrop in Massport, there are always going to be disagreements. That just is going to happen. I accept it. I think Tom accepts it. But one thing I'd have to say, that when this report was done originally, the next week in my office, and Anthony can back me up on this, we asked Tom to come in, and I says, okay, we got the results. Now what are the actions going to be? What are you going to do about this? And this guy didn't hesitate once in terms of he felt that there was an obligation that they had to address the asthmatic issue as well as other issues that there may be. And I'd have to say, in all the years that I have served as a selectman and now as a state representative, I can't remember anyone more responsive, not just to Winthrop or East Boston, but to any contiguous communities or any communities which are affected by the airport in any way than Tom Glynn. And I want to personally thank you for that, Tom. You've been a good man. And of course, does that mean I can take all this stuff home? What is that? Peter Gill said that's all this stuff that he's going to loan to the town. Mr. President, thank you for being here as well. And for all your work on behalf of the community and being part of this throughout the whole process, fighting for the Winthrop residents to make sure that they were adequately protected. And the same, Mr. Manager, for you as well. It's great. I don't want to hold up anything more because I love to get checks. Not me personally, but put to good use. But I think it is. I think it's important. I think this is a milestone for our community. I really do. I looked at this, quite frankly, when the report came out, and John, you and I discussed it, especially being the superintendent of schools, this is just the beginning. Just the beginning of addressing an issue that probably has existed and probably has existed for all too long. But now, for the first time, because of the partnership of all those folks that I have mentioned, we're doing something to address it. So, on behalf of all of you who are here, or any part in it, and the people from Winthrop who will be watching, I want to congratulate them for their sticking to this and making sure that we do everything and anything that we can do to protect the health of the residents of our community. Thank you very much, and God bless.
Thank you, Mr. Speaker, again for your leadership. So now I'd like to introduce Senator Anthony Petruccelli. The senator and I go way back. Our families go very far back. So I'm actually used to calling him Anthony, not Senator. But Anthony was one of the, Senator Petruccelli was one of the first individuals to call us when we had decided to delay the Winthrop Health Center project, and was one of the first people to say, how can I help? You know, what can we do to make sure that we can get this back on track and make sure that this happens, and how can I help with Massport and this study? So again, great representation here in Winthrop and a great leader in Senator Petruccelli, and I'd like to welcome him forward.
Thank you, Manny. Very kind words, and I'm always very kind to Manny because growing up in the same neighborhood, he knows some stories I like to keep kind of. But first, about the East Boston Neighborhood Health Center, it's a great opportunity for the people of the town of Winthrop. I want to thank you for your efforts to come back into the town. I get my primary care work done at the East Boston Neighborhood Health Center. Dr. Silver, I don't think she's taking patients anymore. I think I was the last one. And I'm very happy with the quality and efficiency of the care that I get at the East Boston Neighborhood Health Center. So it's a great opportunity in addition to the town of Winthrop. So that's wonderful news. You get what the speaker was saying, Tom, he was saying, it's just the beginning. 170 is a nice, he was saying that's a nice start. But very, don't go away. But on this issue, you know, when I first got in the House of Representatives, it was 99, and so it was the runway 1432 debate that was very public, and I commend the folks at the Town Hazards Committee. I had been at the time working with our friends and colleagues in East Boston's Air Inc., Mary Ellen and Gail and the folks. And one of the things that I heard from people on in 99 and 2000 was the issue. We've always heard about the noise, not to minimize what the impacts of noise are, because they are profound. But no one really talked about, nor were there any programs geared towards identifying the problems with the air that we breathe and the effects and how we address that in the future. And so that was the cornerstone of what the speaker and I were looking to do when we put this together. And he's being very bashful. I was just representing East Boston at the time, remember, so I was gung-ho. And I had language in the original budget, this was fiscal '01 budget, and it had a nice health study for East Boston, and he grabs me in the chamber with a piece of paper, he's an amendment, he's like, hey, come here for a second. Is it okay? I want to add Winthrop to it. And so that's where we came up with the language to broaden it and create the 5-mile radius that was used. And so, Mr. Speaker, always, even though you were just the chair of third reading, you weren't the speaker, Mr. Speaker, always standing up for the town of Winthrop. And I want to commend you for your work. And all joking aside about what I said about Tom, Tom has been really a breath of fresh air for a lot of us in East Boston. His accessibility is more than we've ever seen from an executive director standpoint, not only for a speaker or for a senator, but for people in the community. There are community activists that I know share that opinion, and I thank you, Tom, for that. It's wonderful work that you do, but it is just the beginning. So thank you very much.
It's a theme developing.
It's a theme, but it's wonderful. So we thought, you know, let's create a foundation of what we can identify as impacts, and then it'll be a long road to try to cure those impacts and help. And Suzanne, thank you for your wonderful work. It's been a long time. I appreciate your steadfast resolve on this issue at the Department of Public Health. You've done a wonderful job with it. I'm blessed to have great partners in the council president, Peter Gill, and the rest of the local officials. So it's a great day. I appreciate the opportunity to play a small role in this event. So have a good day. Thank you.
I think Senator Petruccelli has given us permission to add another 0 to the check. I knew it would be on the side. So now I'd like to introduce East Boston Neighborhood Health Center's Chief Nursing Officer, Bernadette Thomas, to the podium to talk a little bit more in detail about the program that we're looking to launch here in Winthrop and talk about any of the items here that we have on display. Bernadette?
Great. Hi, thank you. So I really apologize. I was actually testifying this morning and it was supposed
I told him not about a
Yeah.
vote today.
Yeah, so
Right now.
don't ask me anything about it, but it went really late, so my talking points are here on my phone, so please pardon me as I read them. But, and I'm sure as you all know, that asthma is a highly prevalent chronic condition affecting millions of adults and children and disproportionately affecting poor minority populations, as well as those who live in urban areas with poor access to optimal housing stock. Direct costs of the illnesses related to air pollution, including asthma and COPD, are in the tens of billions of dollars. And the indirect costs, which include missed school days for children and missed work days for adults that care for those children affected by asthma. And as adults, those same children continue to suffer from asthma, of course, and also experience lower productivity as adults. And they lose an average of 5.7 days of work per year with asthma-related causes. So it's something that persists throughout childhood into adulthood as well. As you all know, East Boston Neighborhood Health Center is honored to serve the Winthrop community and to work in collaboration with Massport, with the public health practitioners here in the community and the educational professionals as well. We have developed an evidence-based multimodal program which actually is based upon the experience of states in our region, Rhode Island, Connecticut, Massachusetts, and it delivers comprehensive asthma care services to the people of the community and includes multiple service locations which will include schools and homes. Children and families will receive comprehensive asthma action plans, care coordination services, and home visits, which will include these amazing items, which I'm happy to explain any of them to you, to help assist with environmental remediation and risk factor reduction in people's homes. And those are my brief comments, and I'm really excited to be tapped on the shoulder to give these remarks, and I thank you for inviting us into your community to provide these services. So thank you very much. Do these need any?
Explain yeah, because I
Yeah.
don't think everybody
Yeah.
knows exactly
Sure.
how all these things work.
Yeah, so this is a really well-evidenced program, and I'm actually new to the East Boston Neighborhood Health Center, but we have a similar program in Connecticut, which is the state that I come from. So basically, home remediation programs include going into the home, doing a thorough risk assessment evaluation of what those environmental risk factors that actually irritate people's asthma are. And they can be numerous. It could be carpeting, it can be curtains, it could be tobacco smoke, it could be the type of cooking instrument that the family has. So, for example, gas stoves are more irritating than electric stoves. It can be not having a fan in the bathroom and not having adequate ventilation in the home. So there's about 20 to 30 different risk factors that a visiting nurse can identify in a home and help a family remediate. So there are some structural improvements that we can make in homes to help improve families and reduce the symptoms of asthma. But these are some of the equipment that nurses can actually bring into home and other public health professionals. So a vacuum cleaner with a HEPA filter, actually the recommendation is you can, as much as you can, to actually vacuum the carpets and the upholstery and the window coverings with the HEPA filter to reduce allergens, to get, and one of the other remediations, to actually get parents who smoke to smoke outside of the home or to get them to quit. Cleaning more frequently, that's why there's cleaning supplies involved. And what you don't see here is actually teaching parents about what to clean with. A lot of parents, and maybe your own, clean with bleach. And bleach is one of the most irritating substances that you can use in a household that has somebody who's living with asthma. So the public health practitioners and nurses who go into the home also teach parents and families what other kinds of cleaners that you can use in that house. And this is the way you clean your house, so using the sponge and the mop, and to really do dust remediation and not use irritating chemicals in the home. And these other, the other components that you see here are actually mattress and pillow covers. So that actually, dust mites are prevalent in all of our homes. You don't even know you have them. Some of you are probably sensitive to them and some aren't. But if you put protective covers on your pillows and on your mattresses, you can actually reduce allergy to these dust mites and then thereby reducing the symptoms of asthma. So really comprehensive components. These sterilites, I'm not familiar with these. Maybe there's somebody in the audience who can let me know what role they play in the asthma program. They might, I'm not really sure, they might be used to store some of the equipment here. But then there's also a door sweep, which I would imagine in this particular program, so, and again, I apologize for being new to it, is probably meant to keep moisture out of the home and dust out of the home, again, to help reduce irritants in the home. So I'm happy to answer any additional questions that you might have.
We're ready to give you a check.
Yeah, I think I should announce that Bernadette Thomas is the newest member of the East Boston Neighborhood Health Center.
Yeah.
She comes to us from a large health center out of Connecticut with over 40 sites. She has a doctorate in nursing from Johns Hopkins University, and she's a family nurse practitioner. So we are so excited to have Bernadette on our team. She will lead this effort. She will also lead the effort for the new Winthrop site. So she has a lot of work to do.
Yeah.
I also want to recognize President Peter Gill, President Council Peter Gill, and Town Manager Jim McKenna, who has volunteered their efforts to help us identify the right location for our newest site and give us the support that we need. So thank you again. I think now's the fun part.
Now it's the fun part. If I can have Tom Glynn join you and others, we're just going to move this. We want to make sure that.
I should also announce that our board chair, Rita Sorrento, is also here. Without our board members who are made up of residents from the communities that we serve, including Winthrop, we can't get the work that we need to get done. So I'd like to welcome Rita Sorrento.
Speaker, everybody.
I just wanted to take a moment to see if Suzanne Fon would like to say a few words. Again, the author of the study, and I know this is, we've waited a long time for this, so thank you again.
Sure. So I wanted to thank everybody here for their partnership. It has been a real, I think, rewarding experience to not just do this type of a study, but to see that there is a follow-up at the end. Oftentimes we come up with findings and we're left with either doing a follow-up study or trying to come up with resources at the state level to try to see how we can best address these types of issues. But I think Massport has been a real partner, and I remember early on in the years with the early Winthrop Hazards Committee when folks said that sometimes the relations were turbulent, to say the least. But I made a commitment that I would work very closely with Massport, and that at the end of the day, the results would speak for themselves. We would do a very thorough study. We would have it externally peer-reviewed. We would share any criticism, and because we welcome critical review. But I think in this particular case, we identified some issues that were important to be followed up on in the committee. We have wonderful legislators that I will say, I think at least annually on this study, I heard from the Speaker and the Senator, just to make sure that I wasn't letting people slow down a bit, even when the budgets were not the best. But this was always a priority for us, and I think it's just been an incredible partnership. To me, it's the true example of a community working together with their legislative leaders, with people in government who are tasked with protecting public health, and people who have a real community partnership such as exists with the folks at Massport. I think I've seen this all come full circle, and just before I stepped up here, I went over to make sure Bernadette knew who I was, so we can try to continue to work closer, because this is part of a larger effort, and that we need to, I think, make sure that we're being consistent in how we move forward to provide that type of care, notably for children. This has been a true passion of mine. I've been committed to exploring environmental risks associated with pediatric asthma ever since we started doing surveillance many years ago. So I think this is a great example of how to do it right, because sometimes we don't always get it right. But this time I think it was right. So thank you.
Thank you, Suzanne.
You guys, everybody probably knows me from TV, that's about it. I'm Tony Mantiad, the chair of the Winthrop Airport Hazards Committee. Its actual name is Noise, Air Pollution, and Winthrop Hazards, which was incorporated in 1971, I believe. And I'm here to give kudos to Jerry. Bob Driscoll is out recovering from surgery. Speaker of the House, who was in charge of Ways and Means at one time, which is a powerful position. David Phipps, who's not here. And of course, Dick Banks, who just showed up, I think. And let's see, who else am I missing? And of course, John Petruccelli. And all these people have been, and I'm a Johnny come lately, so all these people have been pushing over the last 40 years to accurately describe the effects of health effects onto Winthrop from the airport. And I don't want any applause, but these guys are like long-term knights trying to protect the community. So thank you, guys.
Thank you for recognizing that. That concludes our program. Any questions? Thank you again for joining us for this exciting event. Great opportunity. More details to follow.